เมื่อมองดูนกพกพินบินลับไปเมื่อมองสายชนถึงไหลริน
We watched two different documentaries relatively on the same topic. Okay? The eating and cancer with Dr. Brunetti. Okay? And disclaimer, I know Dr. Brunetti personally, so, you know, I have a little prejudice toward his point of view because I've heard his story in person from him. Okay? That's one thing. And he is, I can tell you because I know him, that he is in the naturopathic medical community considered a rock star from the science point. He's considered a rock star. He's considered, and another reason is this, because there are a lot of people in the natural health field who purport themselves to be experts in natural medicine and natural health. And really they do. And they have YouTube channels and all this. And not a one of them has ever operated a clinic or had a clinical practice or treated a person who was dying of a critical disease at all, ever. And so you got all these people who are going to give you advice about how to treat your cancer, your terminal cancer, your heart disease, your diabetes, your metabolic X syndrome, your pathogenic parasitic infectious disease, your chronic respiratory disease, your MS, MBC disease. You know, the ones that the mainstream media literally invents. And that's a whole nother topic. I can actually give you a list of disorders that were not invented by doctors, that were invented by media, and which eventually caught on as a social thing and then have been added into medical discussions and the medical community as if they're real diseases, only they're not, and they never were, and they aren't now, and they never will be. Just because Anderson Cooper calls it a disease or not doesn't mean that it's a disease or not. He has got no criteria to be able to make those kinds of disclaimers. None. Zip, zip, zero. Zilch. Okay? However, like the good naturopathic doctors that I show you in the documentaries have clinical practices. They have actual clinics. Okay? And or they're working in actual hospitals, or they're working in actual multi-practitioner, multi-discipline clinical settings where they treat people for catastrophic illness every day. Okay? So, do you have to be one of those people currently or forever to be able to have an informed opinion? And the answer is no. Right? Because right now, I'm not working full-time in a clinic like that right this minute. I'm spending more time teaching and creating educational materials and talking to people like you than I am working in a clinic with critically ill and catastrophically ill patients. But I had such a clinic for 14 years. And right on Main Street in downtown Chinatown in Chicago. And I worked as an affiliate in an acupuncture college's clinic, Midwest Center for Acupuncture in Chicago. I worked at AIDS Hospice. I worked at an AIDS hospice in Chicago. Okay? And then I also worked at other clinics, because that's what I did. Like I had my own clinic that I owned and operated. It was 1,500 square feet of real estate right on Main Street in downtown Chinatown, Chicago, which I owned and operated for 14 years. And then I taught there. I also taught classes. I also had clients every day. I wasn't in class. And when I didn't have clients, I actually ended up scheduling several days a week that I worked in other clinics. And so I would go to the north side up to Winnetka, or I'd go to Devon Avenue and work at the Lightworkers Center at the Ayurvedic Medical Center for the Krishna community, because Chicago has a humongous Krishna community. Okay? And that's where I met Prithu and the other North American leaders of the Krishna consciousness community, and became really good friends with them because they were my clients for years, right? And that's how it's when I would go, the AIDS hospice was off of North Avenue, is north side. And so I'd go to North Avenue, but see, I lived south side in Halstead. I lived in the hood. And then I would go to Chinatown because that was the closest place for me to work. And then I would just go north and west and east and, you know, wherever I needed to go. But I worked in other people's clinics. And so my friend, Dr. Frank Urasek, who was at the Midwest Center for Acupuncture, I worked with him, and that was 30 years ago, and we're still good friends. And he's still rocking the critical care, but primarily focusing on acupuncture. So acupuncture for cancer, acupuncture for critical heart disease, acupuncture for what's going to kill you, whatever's going to kill you. And then one day a week, he's the lead acupuncture doctor for the state prison in Marion, Illinois, for 35 years. So once a week, he's gone to Marion, Illinois, to the federal penitentiary to do pro bono acupuncture on lifers who are sick, who are very sick. And then that day, he also does an hour Tai Chi class. He's taught an hour Tai Chi class once a week at Marion for 35 years to lifers. To lifers, and anybody else, I guess, who can get into his courses. And he's continuing that right now, still doing that right now. So when we hear an opinion from Gary or from Frank or from whatever, see, that's when you want to perk up a little bit. You want to perk up. Why? Because they're not doctors in word, they're doctors in deed. They're not doctors in word. They're not experts in word. They're not expert pundits and opinionated people who did some research. Nothing wrong with that. In fact, I advise you to do it all the time. And I'm always putting out materials for you to read and to research. In fact, right now, I'm going crazy on this vaccine course. And it's going to relate to lots of things. Okay? It's going to relate. Because it is not just an upcoming issue because of the pandemic. It's been an issue for 50 years. And it's not going away anytime soon. So if you're going to call yourself a health practitioner, at some point, in some way, and I don't care what your age is, I'm affected by it. From childhood. I've had illnesses and allergies and issues of health. I had cancer. So just throw that on the Barbie. I'm a cancer survivor. Some of you already know that. And I had 3 surgeries. And I had bone cancer. And I had reconstructive surgery on my face. And they did a really good job. And the only thing you can see for it is this dimple on this side of my face. And it's not natural, or there'd be one over here too. And I have no feeling in my face from the midline of my face over to this ear, because when they did the last surgery, they clipped the median nerve in my face, and I had to go to physical therapy and learn how to smile again and not drool when I'm relaxing. Because if I don't pay attention, my face will sag on this side. And sometimes it still does. And sometimes it comes out like a little difficulty forming a word. But you'd never know that unless I told you, probably. Unless I told you. But see, it influences, why do I talk about cancer in a yoga class? Why do I talk about cancer in a therapy class? Why do I always talk about cancer? everywhere I go. It doesn't matter. Oh, Dr. J is going to talk about the 4 principles of the practical expression of love, unconditional loving kindness. And the first word out of my mouth is cancer. So in that respect, I am one of those broken records. Because not only is it something that's been influential for my own life personally, and since I'm a survivor, I get to have an opinion about that. It is part of also why I'm an alternative doctor. It's also why I'm a monastic doctor, and I'm not a wolf in sheep's clothing, someone who pretends to be a natural doctor but will prescribe you Viagra and Prozac. It's not going to happen. Why? Because starting with my family's history, starting with my history, and then education, then operating clinic, and then working in clinics in 5 countries around the world, I have a different impression of what works and what doesn't work. And I know everybody has it. Every medico has their impression about what medicine works and doesn't work where they are, where their office is, where their hospital is, where their clinic is, based on their own experience. But see, if your experience is defined by an artificial construct that all medicine by definition is a factor of the administration of a chemical, pharmaceutical, drug, surgery, or radiation, then your experience will be skewed in adaptation of those factors. If your practice of medicine is under a literal, legal constraint, which is enforced by men with guns, that you follow a peer-reviewed scope of practice that is administered, literally written by drug companies. Literally written, scope of practice written by drug companies. Where the heads of like National Institute of Health and CDC and so on are former drug executives, major drug company executives, former presidents of drug companies. And to think that their opinion on what constitutes medicine is not influenced by the fact that they're multimillionaire investor, owner, founders of drug companies, well, that's a little bit naive. Just a teeny tiny bit. So we don't look to them for answers for real issues. We don't look at them. We look at clinicians and we look at people who have, I want to say, an invested interest in not dying versus an invested interest in profit over everything. And corporate profit over everything. And when we say corporate profit, we mean basically 6 companies that own 98% of the industry. Those guys. And you know their names. Pfizer, AstraZeneca. You know their names. Because they make everything you take in the world. So no, I don't look for them as my resources. I look to people like Mike Anderson. Fair disclosure, I know Mike Anderson also. It's a thing that Dr. J does. If I find a documentary that speaks to me, I do it. It's chicken or egg. I don't know which way it goes. Sometimes, like, I meet someone like Gary at the American Naturopathic Medical Association's national conference several years ago, where I was one of the keynote speakers at the ANMA National Conference in Las Vegas. And I was on the dais, and I was one of the keynote speakers for their, I don't know, it was like the 83rd annual conference or something like that. And I met Gary, and I went to his presentation, and I was like, oh my God, this guy is really knows his stuff, and he ties a lot of loose ends together nutritionally. That's his primary focus. So I go over to tell him how much I appreciated his presentation, and did he have any materials that I could get from him and all this kind of stuff. And he goes, "You're the guy." He goes like that to me. And I go, "What do you mean?" Is that a good thing? I don't know. You're the guy. He says, you're the only person in this whole conference who defines the practice of medicine as an expression of loving kindness as the first thing out of your mouth. And I go, and? And he goes, dude, you're right. That's it. That's what we forget. We get so lost in the science, and we get so up in the technology, and we get so into the statistics, and we get so into the values, the analog values and comparisons, and we get so off into the little bits of how this enzyme works with that vitamin, that works with that mineral, that works with that. We get so lost in that we forget. Everybody forgets that the only reason we're doing any of this is because we care. Bottom line. There's no reason to do any of it if you don't care. If you take money out of the equation as your only motivation, there's no other motivation to do healing work unless you care. And I'm not backward, bashful, shy. Certainly the senior students here know that I will go up in front of a medical conference in front of 400 doctors from 51 countries and tell them, call bullshit on them if they're practicing medicine that is not about the expression of love and compassion as their primary motivation. And I will call BS on them. I might even show you one of my presentations that I did like that with an international medical conference on cancer and oncology. And I call BS on all the cancer doctors who are millionaires and that the only reason they're doing cancer medicine is to be millionaires. And live in the big house and drive the fast cars and have the trophy wife and have the whatever. And they're sitting there with their trophy wife next to them. Not personal, because I don't know all of them. It's like 400 doctors from 51 countries. I don't know all of them, but I do know some of them. And I'm like, it's okay to make a good living in natural medicine. Just don't make everybody's living. Just don't take everybody else's living from them so you can live in the big house. Okay? So Mike Anderson, yeah, I know him. He told me his story first in person. First time I heard his story. He was a reporter for a CBS affiliate in San Diego, California. On air, reporter. Okay? His father got sick. He went through the process of dealing with his father's illness. And his father died. He was a reporter. He is a journalist, a degreed journalist. Mainstream, working for mainstream television news, And he would ask the doctors very specific questions. And one of them that he asks over and over again, is there a better way? And they'd say, look him right in the eye and go, no. And they'd say, well, is there another way that is less invasive? And they would look him right in the eye and go, no. And he would ask, are there other drugs? Because see, at this point, he didn't know that it's possible to have medicine that's not drug-based. So he would ask the question, are there drugs that have less side effects? Less harsh side effects for treating my father's illness? And they would look him right in the eye, and he said once he asked that question, the good doctor in his white coat with a stethoscope around his neck, little name tag, hospital facility embroidered on his lab coat. Right, I'm gonna get, I don't own one of those, but I should, just for kicks and giggles. I'm gonna teach a class I do have scrubs. I should do that. Because Doc makes me wear scrubs when I work in the clinic in Nevis. He's like, you gotta look like a doctor. I'm like, damn it. Anyway, so yes, I do own the accoutrement. I got 8 pairs of stethoscopes. Do you have 8? How many do you have? Really? That's all you own? Psh. 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 Well, I only use one, but I own 8. And they're still in the packages. You know? So, for example, the doc walks over to him, puts his arm around his shoulder, and goes, no. We're giving him, I'm prescribing him the very most well-researched medication for his condition. Cancer, heart disease. Which is a perfect storm, by the way. Just like COVID plus cancer, COVID plus heart disease, COVID plus, it's a perfect storm. So is pneumonia plus cancer, pneumonia plus the flu plus cancer, the flu plus heart disease, the flu. You just name it, right? These are called comorbidities. They're called comorbidity, which you can get used to hearing that phrase, okay? But they're called comorbidity is because either one of them by themselves can kill you, but both of them together are likely to kill you. You're not likely to survive if you have more than one. And according to the tables I sent you today, table 3, okay, from CDC, November 4th. Next one comes out November 12th, by the way. So we track that. I'll have the newest one when it comes out first thing on the 12th. I'll have the newest one, right? But the 4th is the latest one. It's the news until the 12th comes out, okay? So every 8 days or so, CDC updates the numbers. All right. So according to the table 3 in the current weekly mortality statistics for COVID, 9 out of 10, more than that, it's actually quite higher than that. Only 6% of people will die from COVID. That's their highest number right now that they're saying, okay? And 100% of them will have terminal cancer, or will have terminal heart disease, or will have a terminal sepsis infection like MRSA. 100%. Nobody's going to die from COVID on the CDC charts who doesn't have these things. Nobody. Nobody. That's on their official table today. And if you look at it and you say, wait a minute, well, is that because they've come up with such good treatments and so the mortality is lower for non-comorbidity? Is that it? No, because the chart I'm referring to, the date of coverage is from February 12th to November 4th. February 12th to November 4th. In age 0 to 21, 452 deaths. Every school in the country closed down for 452 deaths. And every one of those children who died had leukemia, had a terminal cancer, glioblastoma cancer, leukemia. You know, the things that young people die from. Or were killed in car accidents. Because that's included too. If you had a positive test and you die in a car wreck within a certain period of time, you are a COVID death. Even if you were just in the back seat of a drunk driving accident and you were killed, you're on the number. In fact, out of that total number of deaths, 275,000, give or take, okay, we've isolated 6,000 people that were killed in car wrecks. Out of that number. So whoop, take that right off the top. Yeah, go ahead.
So I do actually have a friend that's attending a university right now. There's one of the 452 deaths happened at this university, but she did have a comorbidity. She had asthma. She died at the age of 20, but
yeah.
She died of thrombosis because apparently the new research that's coming out on COVID, that
No.
there's an effect on the vascular
No.
system?
Nobody dies of thrombosis. Nobody.
Blood clotting?
Nobody. Nobody's ever died of thrombosis.
Okay.
Okay? Because you have to know what is a thrombosis. You say blood clot. Why is there a blood clot? That's what you die from.
Well, apparently COVID has effects on the vascular system as well, not just like the respiratory.
So does every pneumonia, so does every cold, so does H1N1, so does influenza B, so does every corona, all 25 of the corona conditions, plus bacterial pneumonia, also do that.
Okay, so to confirm
The test means nothing.
okay, so the effects that COVID has, apparently, like coming out with the research, of course, up until now, the research on the effects on vascular system, the relation to thrombosis, those things are not related to COVID.
Unrelated.
Okay.
Peripheral. Let's put it, lungs are lungs and lungs are related.
Okay.
Okay? But what you have to understand is, according to the official numbers right now, this minute, no person under the age of 21 has died of COVID. Nobody.
Oh, she was 20. Actually,
Nobody.
it's unrelated.
Zero.
Unrelated.
Zero. In other words, the number of people under the age of 21 who have died from COVID is zero. 0.0000. It is zero. That, I'm saying as of November 4th. That's the sum total from November. And I want you to understand something about this. Don't trust me. The reason why, for example, I'll give you the links, and why I sent you the link today is so you could go look for yourself. I know your friend said this, you heard this through the grapevine, you heard whatever, somebody said, and you know what? They're all wrong. Okay? They're all wrong. Because the numbers don't lie. See, the numbers don't express an opinion. What are those numbers based on? If you look at the statistics for the collation of it, okay, it's 170 million entries in 51 categories, which is in 27 pages in an Excel file, which you can download. You want it, and it's broken up into the 21 different categories, so you can get your 10 million of this and 10 million of that, and if you want to, you can crunch those numbers yourself. And there are people doing that, like my friend Dr. Michael Levine, Nobel Prize winner in chemistry 4 years ago. Nobel Prize in chemistry. And like Michael said, I can run some numbers. Because all the statistics that he presented to the Nobel Committee for his Nobel Prize, he ran himself. And then they were fact-checked by a group of 50 other scientists from 50 other countries around the world to verify that his numbers were correct and that his statistics were accurate. Michael Levine, a month ago, looked at the current numbers at that time and said there's no deaths from COVID. So far, nobody's died from COVID. So far. Because there's not one single case where there's not severe pre or comorbidity. That person would have died if they had never gotten COVID. Now, I hate to say it, but we got to have these conversations. We're not in a fluffy class, and I'm going to say it. Not one single one of those people would have died. Be accurate. Nobody has died from COVID yet, okay? And no one has died without comorbidity. No one, not one single verified patient, okay? And the one, for example, the one youngster, the one 19-year-old who died in Miami, and they claimed as a COVID death, was the first teenager in the United States to die from COVID, turns out was terminal leukemia. She would have died anyway. Terminal leukemia with a brain cancer. She would have died anyway. Like 98% chance that she wasn't going to make it 6 months, no matter what anybody did.
Was that post-mortem diagnosis of the comorbidities?
Yes.
Did she know?
Oh no, she'd been in treatment for 2 years. Go ahead.
Okay, crunch numbers.
Yes, and nobody wants to report on those numbers because they'll make you want to scream and pull your hair. Okay? They're on the CDC. It's one of the categories. So there's also another table. I forget if it's table number 1 on the summary, weekly summary, table number 1. And it says how many people died in ICU, how many of COVID died of COVID in an ICU. 100% of those are ventilator deaths. 100%. Okay? Yeah. Because just to cut to it, and thank you for being interested. Depending on who you talk to. I have friends who are ICU doctors. I have a good friend, Dr. Joe DeTuro, who owned the closest walk-in emergency room in downtown Manhattan, a block from the World Trade Center at the time of 9/11. And he was on duty at the clinic which he owned. It was the principal owner of his emergency room walk-in care clinic on Broadway in Manhattan, okay, when everything went down. He saw the blast go in front of him.